firm in the sector of laser bioprinting. Fosprint is a spin-off company from the Institute of Communication and Computer Systems of the National Technical University of Athens. Ioanna, thank you very much for being here today with us. And
thank you.
Is yours.
Thank you very much for inviting me to share my experience on the setting up this spin-off company named Fosprint, as you said. So good evening to all the participants. I'm glad to present in a short story the Fosprint background. So Fosprint is a company founded in 1.5 years ago. It is aimed to 3D laser bioprinter solutions and services. I am one of the co-founders and the CTO of the company. So we are a high-tech spin-off company. We are established as an IKE, and we work on 3D laser printing technology attractive to researchers and developers primarily in the biomedical sector with our compact laser printer. We have worked a lot to establish intellectual property. So we have a PCT and back to 2017 and the US provisional patent submitted this year. We have a fully functional pre-industrial prototype and we're currently testing applications on tissue regeneration on bladder. And we have an excellent team to work as I'm going to present you now. So we have Dr. Simon Papazoglou is our CEO. I am the CTO of the company. We have Dr. Tinakis, who is a biomedical expert, molecular biologist by training. Maria Palidou, she is our CFO with many years background in financial management in Johnson & Johnson and other companies. And we have two valuable advisors with a good background on running similar spin-off companies at their universities. And as Emilia said, we are a spin-off company from ICCS, which is the institute. Actually, we were the first spin-off company of the ICCS. It took us some time to establish the legal aspects of this initiative. But we are very happy that we have proceeded to this venture. So the technology our story with Fosprint started a few years ago as we patented the dual laser beam transfer. That was our invention back to 2017. We incorporated Fosprint as a spin-off company on 2019, and on March we were funded by a grant from Bodosaki Foundation to support all our IP costs. That was really very important because, I mean, for a startup, for a spin-off company, high-tech company, the main value is the IP. So then we have, participated in some competitions and some fundraising. Like, for instance, 1 year ago, we got the EU Seal of Excellence under the SME Instrument Phase 1 competition. And then at the beginning of this year, we succeeded with the grant from the Accelerator Science Park of Patras with our first 50,000 euros. We submitted, we have worked a lot during this period, basically focus our application and attracting fundraising. So to this end, we have focused on a specific biomedical application for bladder regeneration, and we have filed our US provisional patent this August. And very recently, we were granted with 2 European projects, one for tumor as an organ on a chip, and the laser bioprinting technology helps to print tumor spheroids for the basic understanding of cancer. And another one that is under a FET open call, Europrint, that aims basically the bladder regeneration application. So Fosprint right now has the participation of these 2 European grants, but of course we are looking forward to enter the real market. I mean, we have participated in the last February, just before the lockdown, in San Francisco on the semi-finals for startup companies who have qualified on the semi-finals startup challenge. And my group won the 3D printing award on the same big conference. That's the biggest company, photonics company worldwide, more than 5,000 companies, and the same number for scientists. So we had a very good recognition of our work on this direction. However, this is not enough. In order to be, successful in the entrepreneurship field, you need more than that. I mean, more than the academic or research recognition. So our competition is here in terms of the technologies. The existing technologies for bioprinting is the inkjet and the extrusion, and there are many established companies in this sector. So we are working on another new technology based on laser, offering higher spatial resolution and higher cell viability. So laser finds its position to the printing technologies more and more, but still, I mean, it's not an established technology for commercial products. So this is the principle of this technology is the outline on this small video. I mean, the laser pulse comes from this way, injects a droplet which is printed on the top of the substrate. Our IP, intellectual property, is based on a dual laser beam transfer. So with the first laser, we print the droplet, and there is a second laser that comes and functionalize and post-process the bioink. With this dual laser transfer, we offer higher immobilization and encapsulation of the printed features, which offers specific advantage on the printed products afterwards. I mean, I have to say that I am coming from an academic ecosystem. I'm a professor and I used to be a researcher all my life. So this is a result of a very focused research work for more than 2 decades. I mean, I was quite obsessed with developing a specific technology and to advance the laser processing for this application. So there are a number of publications on the field which led us to this. To this decision. I was first author of the first publication worldwide that we used laser pulses to print DNA back to 2005. And then at the National Technical University of Athens, we continued with many other applications and publications on the field. In the last years, we were focused to develop the process, not only for the printing, but also for the immobilization. Maybe this is too technical, so I'm going to proceed. This is another technical, the last technical slide I think I have, and it is an example of printing of cells on different substrates and materials. So basically we print different kind of cells and different kind of medium for 2 different applications. One is for biotechnological applications like pharmaceutical products or other bioantibodies or this kind of materials. And the other main application is for tissue regeneration. So the problem is that we try to solve is that there is an increasing demand for high resolution and digital printing of complex structures, increasing demand for printing of tissues and organ regeneration and transplantation worldwide. So there is a need for disruptive printing technologies for biotech, pharma and medical sector, and disruptive and effective technological solutions to address cell and tissue issues and to improve the quality of life, of course. So our solution offers is on 2 mainstreams. The first is to sell the printer on academic and private research labs, biotech or pharma, and the second is to establish a focus application which addresses a specific regenerative application problem. And I'm going to talk for both now. I mean, this is our printer. Is an industrial design of our printer. That means that we offer this printer for any biotech laboratory for, everyday experiments and printing of biological solutions on different substrates. So that's our primary revenue stream. And the secondary revenue stream is to focus on a specific application in regenerative medicine. That will, the roadmap for this is about from 2 to 4 years to develop. So our target customers are research academic institutes, biotech and pharma sector. For the second stream is we focus on university hospital and clinics, focusing on experimental surgery units and offering a new surgical tool for their research. So currently we are working with the group, and we have a contract with a group of Dr. Tinakis at the Bioacademy of Athens, which is next door, hopefully. And fortunately, we have very good access because these experiments are really very, very demanding. And we have already made some first experiments for in vivo testing on the experimental surgery unit. And we now currently intensively continue to work on preclinical testing for the laser bioprinter in bladder tissue regeneration specifically. So our competition is outlined on this slide. We have the technology competition, which is on the right side of the slide, which is basically the other technologies that dominate the market right now, and it is inkjet and extrusion. And there is a big competition from these technologies. However, we believe that the laser bioprinting technology has the advantages compared to the inkjet and extrusion. So within this technological domain, the laser bioprinter, fortunately we don't have many competitors. We have these two SMEs, one in France and Precise Bio in Israel, that they are focused on pancreas and on corneal implants. And there is another group in Fraunhofer. So we are in a good position on this in terms of competition. The market opportunity is here. We are very confident that the 3D bioprinting is expanding, and there is a huge need for a trend for tissue regeneration. This is the challenge we have is to prove that this highly disruptive technology can offer better than the existing ones. We have some, of course, advantages and barriers to others to entry, like our know-how, which is at least 1 year development, and the patents we have currently in our portfolio. So I think this is an outline of our venture. As I said, thank you very much for your attention, and I'm here for any question you may have.